will be conducting the meeting this morning, albeit via telephone instead of virtual. I hereby call the meeting of the Capital Committee to order at 9:05 a.m. Due to COVID situation and in accordance with the new live streaming law, this meeting is being conducted via video conference and live streamed on the MDTA Capital Committee page. We request that all members of the Capital Committee have video active during the entirety of the meeting. And to minimize background noise, I ask that everyone mute your phone when you are not speaking. I ask that when you are presenting or answering a question to turn on your video and audio when speaking, and then of course when you're done, turn your video off and put your audio on mute. Of course, that doesn't hold for us committee members. Understand that there are no members of the public or there are no elected officials or media that have pre-registered to comment on today's meeting. So we will move on to item number 1 of our agenda, which is to approve the open session meeting minutes of November 5th, 2020. So I'm looking for a motion. Motion by Member Cox.
Second.
Second by Member Enzer. Any discussion? All in favor?
Aye.
Aye.
Aye. Okay. Any opposed? That sounds like. All right. Cool. All right. Well, now we will move on to Mr. Wolf, who will talk about KH 3014-0000, the noise wall along I-95 southbound from North Forge Road to Big Gunpowder Falls. Mr. Wolf.
Good morning, everyone. Again, my name is Brian Wolf. I'm Director of Project Development with the Office of Engineering and Construction. I'm here to present KH 3014-0000. This is for the construction of a noise wall along I-95 southbound between New Forge Road and Big Gunpowder Falls. This is part of the ETL northbound extension program. And the work, in addition to the noise wall, includes site grading, erosion and sediment control, stormwater management, and maintenance of traffic, and landscaping work, and some miscellaneous work that's prescribed in the contract documents. We do have 2 allowance items on the contract. We have a $75,000 miscellaneous repairs item, and we have a $10,000 item for public relations and partnering. The engineer's estimate for this contract was $4,592,180.25. We advertised on June 18th of this year, and bids were received in September, on the 17th of September. We had 8 bids received. The low bid was submitted by Bronner Builders Incorporated in the amount of approximately $3.98 million. And we are recommending Bronner Builders for award of this contract. Their bid price was approximately 13% below the engineer's estimate, and therefore there was no bid justification required. There was a bid protest regarding the new healthcare forms that were incorporated into our contracts, but that issue has been resolved. The MBE goal is 20% with African American sub-goal only, and a 1% VSBE goal. Bronner Builders has submitted an MBE plan with 20.01% MBE and the 1% VSBE. And that plan is currently under review for approval by our Civil Rights and Fair Practices. Bronner has completed several projects for MDTA in the past, and also with SHA, and they have completed noise wall construction on I-95 in Howard County. NTP is anticipated in February of 2021, and the contract duration is 365 days. And we are seeking recommended approval from the Capital Committee to present this contract to the full MDTA board in anticipation of approval. Thank you. Are there any questions?
Members, are any questions? We have a motion.
I have a question.
Mr.
We
Mr.
can make a
Gaines,
motion, I can, then we can get questions.
Okay, so we got a motion. We have a
What
second.
would-
Oh, let's get the second first.
Okay, I'll make a second.
All right, Mr. Enzer made a second. Now go with your question, Mr. Gaines.
All right. Brian, what was the issue with the new health forms that we're requiring now?
I believe it had to do with the way, and if Will's on the call, he may have a better idea on this, but I believe it had to do with the way they were submitted. And I don't know the specifics of it. We've had this issue come up on a couple of contracts, but I think we've gotten it resolved now. I know in the past there were issues with how it got submitted with e-bidding and whether or not they were submitted correctly. And this was one of the early contracts because it was bid back in June. It was one of the early contracts that was just when this was starting. We've gotten that issue resolved at this point. We have not had that issue on recent contracts.
Yeah, so Member Gaines, there early on, as Brian mentioned, this is a new law, and so some forms were developed, and there was some differences of opinions on the specific means in which those forms had to be filled out. There's potentially some folks who are exempt from being required to meet the requirements, and so there was essentially boxes.
Will, if I may.
Yeah, go ahead, Jeff. Thank you.
Morning, members. For the record, this is Jeff Davis from the Division of Procurement. So when the law was created, the guidance for it was not completely defined. So there were some issues about whether or not MBE firms, certain small businesses were excluded from submitting documentation. In this particular case, not only was there that confusion, the vendor did not submit all the forms as we were expecting to have them submitted, which because every contractor had their own interpretation of the law, we received a flurry of protests on several bids after this law came out. We've since received guidance on many of the issues related to how to report this law, but there is essentially two documents. There's a spreadsheet where they list all of their firms that are the primaries and subcontractors and what types of health insurance coverage they provide. And then there is a separate affidavit. This is the thing that some firms are potentially excluded from. This separate affidavit is where you state whether or not you are providing health insurance, you intend to provide health insurance per the required dates in the law, or you are excluded. And after several back and forth with the Department of General Services, legal counsel, it has been determined that only firms with less than 30 employees are excluded from certifying that they will meet the health insurance requirements per the law. So what happened in many bids was a vendor would submit the spreadsheet to our requirements, but they might have not submitted all the affidavits, or they would submit the affidavits only for themselves and their MBE firms, not all of their subcontractors, or they may not have included their MBE firms on the spreadsheet. So it was a growing pain for us in the community to get these forms into a format that we could then submit to the governor's office per their requests. So in this particular case, the low bidder had made a mistake on their spreadsheet. We allowed them to cure the spreadsheet per guidance of the governor's office. It is our determination to the responsibility of the bidder, and we have determined that the bidder was responsible, and then the protest was denied. Did I confuse you any worse?
No, I didn't know what the law says. That was really my question.
So the law
basically is requiring health insurance, I guess, sounds like.
State funded, I apologize. So State-funded construction contracts are required to provide health benefits for their employees for not only the primes, but for the major subs. So actually, I believe it's all subs. And
It took them a long
then
time.
the firms have to show that they intend to meet or currently meet this law, and the showing of it is on these spreadsheets and affidavits.
This law just go in effect July 1st of this year, or before that?
The law was actually introduced, I believe, in 2018, but the guidance has been slow. We actually just put it into Comar. Kim might know the date. I don't have that with me, but it was just updated into the Comar regulations. And the requirement to provide the healthcare has been extended because of so many questions from the vendor community, has been extended to July of next year when they must
I guess my question
comply.
was, when the law was passed, normally they go on July 1st, but
Yes,
then
it was
did it
July.
have a drop dead date of when they're supposed to be implemented? I guess that's the question.
July 1st next year is the drop dead date.
Okay.
I don't know what I did differently.
I have another question too, more substantive,
Crazy.
and that is, how do we set our priorities on what we're going to do? Because I don't see how a noise barrier is going to help with traffic congestion or provide for safer highways. I'm just wondering, when in a time when we're tightening our belts, I don't know that this job's necessary. Will? Or, I don't know.
Yeah, it is a requirement to build this wall. The wall, you know, it is. It absolutely is. We had to follow the National Environmental Policy Act, NEPA, to do evaluations for all of our projects that impact federal, you know, interstate highways. And so that was completed for this corridor. There were noise studies done. There were a number of areas. Believe me, we get a lot of complaints in the other direction for the folks that did not receive a wall, that, you know, due to the merits of the investigation, did not receive a wall. So we are only building the walls that are required, that meet from the policy that went through the full evaluation. But these walls, because we are widening the highway, and with a highway widening, the noise does go up. It is required in these areas to construct these walls.
So they're in residential areas, obviously.
Correct.
These walls, yeah.
All right.
Maybe they shouldn't. It's kind of like moving into a rural neighborhood and complaining about the smell of the cows, huh?
Well, there is part of the
Okay.
part of the policy and part of the laws is set up to where if when we get the NEPA study completed, new residential properties that are built after that, is the county is made aware of our NEPA approval, the FONSI, and then they are required to make sure the developers from then on would be responsible for building any walls for new development. So if you, kind of to your point, if you move in next to the highway, you kind of know what you get when we've done this NEPA study. But these kinds of walls are not constructed for those cases. They're constructed for existing residences that are impacted from the changes to the highway.
All right.
Makes sense.
Fair enough.
And any other questions or comments? All in favor?
Aye.
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 All right. Any opposed? All right, we have it. Mr. Pine, since you're talking, I guess you can go right in and notice of toll due processing.
Sure. Well, good morning. For the record, I'm Chief Engineer for MDTA, Will Pines. And as Member Mario mentioned, this is a presentation on notice of toll due processing. So MDTA, we temporarily suspended the processing and mailing of notices of toll due in response to COVID-19 in March of 2020. And so essentially, we, between March and October, have developed a 7-month backlog of NOTDs that has grown and needs to be mailed out. In response to that, as we moved out of phase 2 and into phase 3, with that transition, we issued a news release in September indicating that we were going to resume the mailings of those NOTDs. And so that processing resumed in October, and between October 23rd and November 30th, 2.4 million mailings have went out of these NOTDs to date. The unpaid NOTDs will move on through our process, and based on COMAR, the next step in the process is that those images that are unpaid get certified. And that certification, originally we, from our working group, thought that was going to occur in November. Some COMAR clarification has happened with the team that there's more or less a 15-day grace period from the 30-day payment period in case their payment would get held up in mailing or whatever. So the actual start of the image review certifications is going to be December 15th. We had originally thought we would be able to start in November, but that's been clarified. So from the NOTDs that go out, like I said, we've sent out 2.4 million to date. We anticipate that roughly anywhere between 30 to 50% of those NOTDs will require the image certifications for the citation process to begin. So with that news release that went out in September, we realized that we had a sizable backlog of NOTDs, 7 months worth, that needed to be processed. So in early October, we formed a multi-divisional working group to develop a plan to help to address this backlog, because obviously the existing resources, when you have 7 months worth of work, how do you play catch up? We needed to kind of have a team, and that had members from finance, IT, EasyPass, HR. It was something that really kind of spanned the entire agency to help figure out ways to quickly process these NOTDs. We had weekly meetings to strategize and develop plans with targeted action items at every meeting and due dates to help us get to where we would have a team in place for doing those image certifications. And the core strategy that was developed that kind of came out of this group, we had a number of ideas, but the core one was to transition the toll collection staff from performing COVID-19 screenings at our buildings to doing this image reviewing function to help us catch up on the backlog. We had established, again, as a November 30th as our go live date for when images will commence. But again, there's that 15-day grace period that we kind of realized actually won't make the images available until the 15th. However, our financial forecast was developed based on images processing in January. So the December 15th date is still within the window that the team had identified that absolutely was a must in order for us to help whittle down this backlog and stay within our financial forecast. With that November 30th go live, however, we have moved the toll collectors over into their new workstation areas to be able to do these image reviews. And we also have effectively modified the screening process at our buildings in order to allow for building entry without that direct screener at the building for the, using the toll collectors as we previously did. So kind of giving you some of the background in your workbook, I'm on slide 4, giving you some of the background for our plan that we came up with for how to do this. We obviously did not have housing for all of the image reviewers that we need to work down the backlog. And so the first step that we identified was that we really need to get rooms ready for people to actually do these certifications. So we developed CDC compliant floor plans that laid out the workstations in existing rooms. So I have two pictures there shown. One is our FMT maintenance conference room, which we put up partitions and desks and plexiglass, and the JFK conference room is another. In total, we have a workstation set up at the northern region in JFK, one at the Bay Bridge, one at Nice Bridge, the FMT maintenance conference room, the 2340 building, and our training center at Point Breeze have all been undergoing conversions in order to house the toll collectors to perform these image reviews. So this involved securing the furniture, the partitions, all of the computer hardware, and several of these buildings did not actually have network access back to our vector system to be able to do the image reviews. So our IT department had to work to get the buildings all set up and cleared to be able to access the images. And the training rooms have been all reserved out to mid next year to be able to continue to whittle down that backlog. Additionally, none of the, or very few of the toll collection staff have ever actually done any image reviews. So we worked to get our 88 toll collectors trained from all of the MDTA regions, and did that obviously during the pandemic to get them up to speed on how to do the image reviews. We got the forms signed for them to actually be able to have access to the system, created the logins, and got that all worked through for all of the toll collectors. And then the next major effort that was involved with this is, again, the toll collectors were one of our primary resources in performing building screenings. But in order to be able to use them for these image reviews, we had to come up with an alternate means to perform screenings. And through that effort, we've found out that several of the other TBUs had already developed a screening application that would allow for web users to go on, enter their information, and to basically self-screen prior to building entry. We had a working group within this team that went and reviewed the various different applications. This was like Tanya, Mike Rice, Richard Hamarillo, David Goldsboro, Jerry, to name a few. There's a lot of people that helped get this in place in a really short time frame. But we ultimately selected the M.SHA screening application because it had the most features available. Initially, our rollout with this application was set up to be in the visitor mode, to where visitors and MDTA employees are not, there's no discrete information between them. But this application in a 2.0 version would allow us to link up EIN numbers so that if an employee has been confirmed with COVID, their supervisor and our HR department would get an automatic alert when they fill out the screening app. So that's a feature that we'll roll out with. But to kind of let you understand how monumental this effort was, when we met with SHA, it took them 3 months to develop this application. And when we started talking about customization, when we made the selection of this tool, we basically had 2 weeks to get it in place, to get it there by that November 30th date. So there was a lot of work to have this migrated over for MDTA. And again, this is in place right now. The intranet has a site, and you all probably actually received an email from Tanya about using the screening app for building entry. And finally, the kind of what's next for us. The first bullet was kind of increase NOTD mailings. In October, based on the rates that we were mailing at that time, the goal was to ensure that our tolling vendors were mailing out through their mail houses at least 1.8 million transactions per month. And that was kind of needed to make sure that we were getting enough NOTDs out that we would recover revenue as needed to align with our financial forecast. This bullet noted as if we still had something to do here, but even though this presentation was prepared a couple weeks ago. We've still been working even over the Thanksgiving period. This group has been pushing on various items. And on this particular one, we've already, for the month of November, we reached 2.1 million mailings for November. So we've actually exceeded the goal by 300,000 mailings for that month. Our next step, again, as I mentioned, it is anticipated that the image reviewers will be needed for months to come. This isn't really a short-term thing. It's going to last likely at least through the 2021 period. So one of the things, the next phase to help us to continue to whittle down the backlog is for us to expand the pool of image reviewers. Our first phase was to focus on the toll collectors to get a large group that's seated there and dedicated. Our next phase will be to focus on remote access during the pandemic to be able to get MDOT employees from other TBUs and MDTA employees so that during any downtime, you would say during your day, you can hop on, process 50 images and hop off and go back to whatever it is you were doing at the time. So this will create a much larger pool of people, but those people are not full-time dedicated. They'll just commit a few hours here and there to help process images. That will require a virtual option where we would have the way the vector system works for image reviews. We'll need to get PCs set up that will allow for remote access into the system to be able to process those images. So additional hardware and getting that set up through our IT department is part of the next phase. This, as I mentioned, the screening application, the initial rollout is pretty basic in its features. We do plan to enhance those features to provide better information to our HR department at, analytics related to that screening app. We, with the 3G tolling system transitioning, we'll eventually have them transition out of the vector system and into the upcoming planned integrity launch. And so we've done the training already for vector, sent the toll collectors through that, and we're already developing strategies for how we'll transition those same toll collector group and even these remote access image reviewers into the new 3G tolling system when that's effective and live. And obviously, one of the most important things that we can do is to always continue to improve our brand with EasyPass and to do as much outreach as we can to help reduce the number of NOTDs that we have in the first place. Because, if we're collecting our revenue through EasyPass, then a lot of this concern about the backlog will be minimized greatly. So again, I'm happy to take any questions on this. Just wanted to kind of update you on a major initiative that we've been working through. We do plan to also present this at the Finance Committee, but it's been a lot of really great work from all of the divisions, it feels like, through MDTA procurement help with some things initially with different ideas, because I'm presenting the final product, but we had to flush out a lot of different scenarios to get to this and get people in place. And in a 1 month period to get rooms set up, hardware, software, and 88 people moved over in a month period, trained, it's felt like a very big effort for the team. So we just wanted to give you an update on this. I'm happy to take any questions.
Will, can I volunteer Member Cox to do about 1,000 of them a day? He'd probably be happy to.
No problem. That's simple.
Yeah. Sure.
Any questions? Go for it.
I had a question. I guess I'm a little hazy on the whole process, but didn't you say you processed like 7 million, sent out 7 million bills in October, was it?
I'm sorry, let me go back in my notes here. So in total, between October 23rd, when the mailings resumed of the NOTDs, to November 30th, we mailed out 2,397,142 NOTDs.
So is that different than the image? Do they all have to be reviewed, have the image review done before you mail them out? That's how you get the
So-
information, I guess, huh?
So there's an image review process that our tolling vendor performs, and then there's the image review process that we perform as part of the citation process. So there's two separate steps
Right.
there, but it is a requirement that we actually review the images directly for the citation process. So that's what
So you
we're
get an
getting
initial
set.
bill sent out.
Correct.
Go ahead. There's an initial bill sent out, and then you're gonna do the review in order to process any fines or late fees.
Correct. If they don't pay when the NOTD gets sent, if they don't pay, then it goes for image review so that the citation process can commence.
I have one more
So how
follow.
are they paying the old bills? Are they catching up these? I mean, they basically went for 7 months without paying, right?
Yes, exactly. Without the NOTDs going out, we do have a 7-month backlog, and it does impact our finances for sure. That's why this.
Is it coming?
How's the response been so far?
So in terms of the, as I mentioned, we don't have the analytics on the payments yet because again, you kind of have to wait until the end of the payment period to know whether or not people are going to pay. So we won't know until December 15th how many images are actually in the queue for us to process. So unfortunately, we don't have those numbers exactly, but we anticipate that roughly 30 to 50% of the NOTDs could go to citation.
Wow. Any other questions, comments? Will, thank you for the update.
Thank you, Will.
You're welcome. Thank you.
All right. Next up is Mr. Noonan. We're going to talk about the conduit contract. Will segued us into that nicely.
Okay. This is conduit contract MA 549. It was originally awarded on October 15th, 2005. To date, 29 modifications have been approved on this contract. The MDTA wishes to execute modification 30 to adjust line item funding to move unspent funds from a no longer used line items to line items needing funds moving forward to continue day-to-day operations. This modification is intended to cover costs through the end of the contract, which ends on March 6, 2021. The MDTA is in process of completing modification 31 that will extend the current contract and add additional funding to cover costs until 3G transition. This modification 30 exceeds the delegated procurement authority of the Maryland Transportation Authority and therefore will be presented to the Board of Public Works on December 16th, 2020. Any questions?
Any questions from the board members? I guess my question is going to be what kind of what do we expect from the Board of Public Works?
If you're asking me,
Probably asking Mr. Ports more than I'm asking you.
Yeah, I had a feeling that was coming to me. So Mario, I believe that we're probably going to get some pushback. They told us not to bring the contract back down again for any more modifications.
Right.
When we took the last one down, we intend on working with the BPW. One of the reasons that that I've really pushed procurement to get it on the 16th, December 16th, is so that it wouldn't go on, I believe it's a January 6th date. If we took it in January 6th as originally proposed, the contract would run out shortly after that. I'm sorry, the money would have run out shortly after that, and we would have basically boxed up the BPW in with basically no decision. They would have to approve it, or we would have no contract. So we pushed really hard to get it done on the 16th, so that we could talk it through with the BPW staff first, get kind of a feel and answer their questions. And then we also give the BPW members more time. For example, they could postpone it to the next meeting on January 6th, and we'd be fine with that. Okay, so as long as they approve it on the 6th. So, you know, time will tell how much time or how much pushback we get. But, you know, it's one of those things where, you know, you got to do what you got to do to keep things moving. So,
Jim, how are we setting ourselves up for modification 31?
yeah, same type thing. So our intention is to, when we talk to them about 30, also talk to them at the same time, letting them know that we're going to be bringing together 31. We don't want any surprises. So we just, you might recall my original plan was to have all of it go as one modification due to the timing of the BPW schedule, as well as the effort it would take to try and do that. It was basically deemed by procurement to be impossible to pull them together as one. So we had to separate them. So our intention is, even though they're separated, we're going to talk about them together.
Okay. Any other questions from our committee members? I assume there's no action item required, but from the committee members. This is just informational. Is that correct?
That's actually that's a Kim question.
Yeah. It doesn't say it in the memo. That's why I'm asking the question.
Member, you're correct. I'm sorry, this is Kim. It is just an update item. Actually, when Mod 31 comes, that will come for approval, though. This one's just an update, though.
Got you. Thank you, Kim. Appreciate it.
Yes, sir.
All right. Well, any other questions or anything for the good of the cause?
Make a motion, we adjourn.
All
Second.
right. So second, all in favor?
Aye. I
Aye.
have one comment, Mr. Acting Chairman. Lee, when you go, member Gaines, when you go to Florida, can you find out if you have any razors available down there for one of our members? That would be very, very helpful.
Definitely.
Listen,
I'll-
if